Okay, first and foremost, I'd like to apologize to my viewers for it taking so long for me to get this post up here. I was originally scheduled for 3 levels. I ended up having 5 done. I had pretty rough recovery in the hospital, and really, since I've been home, I really haven't had, the spirits to be able to do this until now. So, sorry for that. But I guess the best place to do or to start would be to, pick up where I left off with my last one. So I got to the hospital. I went into same-day surgery, and everything progressed, somewhat like they told me it was going to. They got me, they went through all the administration. They ultimately got me back into, like the staging area where they speak to you about anesthesia. You meet like a bunch of the nurses that are going to be in the OR with you. They go over everything with you, all kinds of questions, and they give you your IVs, and they let you know what kind of surgery or what kind of, anesthesia you're having. So it was nice to have that. We went through all that, and, I got to the hospital at 5 a.m., and, I went in to the OR, a little bit before 7, which was my surgery was, scheduled for 7 a.m. So I went in there, into the surgery room. My surgeon was in there along with a whole bunch of other surgeons. It was a pretty elaborate operating room. Had screens like up high on the walls and stuff, I guess, for like viewing MRIs and, different pictures and who knows what else really. But they started, having me breathe some gases. They gave me like a shot to calm my nerves a little bit, which didn't really help for me too much. So they got me in there, and then next thing you know, I was waking up in recovery. I guess it was about 7 hours later. My surgery in total was 7 hours long. So I had the 5 levels done, like I said, not 3. They said that the stenosis was so bad on the other levels that my MRI didn't even do it justice. Like the MRI showed nothing of what I was suffering from. Like fatty tissue or ligament or something like that they described it as, or something. I'm not exactly quite sure. I still haven't talked to my surgeon but one time, and that's when I was recovering, so I wasn't all with it. I go Friday for my post-op appointment to get my staples out of my back, and then I'll learn more exactly about what he did, what he saw, and so on. So after my surgery, I woke up in recovery where, they did like vitals and things like that. Now, a little bit about myself. I was on a lot of pain meds before I went into this. I went over those with you. So I had an extremely high tolerance for pain medication coming into this surgery, which worked against me greatly. My doctor said that while they were operating, my body was actually showing signs of distress, so they had to give me, like higher and higher dosages of pain medication while they were operating on me, which I found odd that, they do that. I thought, general anesthesia took care of it all, but it doesn't. They have you hooked up to all kinds of different probes and sensors, to monitor your body. So general anesthesia is just one part of it, and then, the rest is pain medication, and they give you gases through your breathing tube, and so on and so forth. So waking up in recovery for me was just a nightmare. The next 2 days, at least, were the worst 2 days of my life, quite honestly. I had no relief from the IV medications whatsoever. They were giving me Percocet to swallow on top of it. Wasn't doing anything. I felt like I recovered from a 5-level fusion with no pain medications to help me through it. Now, what I did learn is that regardless of how much pain medication they do give you, or if your tolerance is high or if it's not, there's still going to be a considerable amount of pain involved with the recovery. When you wake up after your bones have been drilled, snapped, and so on and so forth, whatever else they've done with them, you're going to have some pain associated there. So you're definitely going to suffer. Excuse me one second. Still having some effects from the breathing tube, dry throat being one of them. So if you see me, sip my coffee every once in a while, I apologize. So, okay, so recovery, yeah, while I was in the hospital. I was only in there for, Wednesday to Saturday, so 4 days, somewhere along those lines. After my first 2 days of pure agony, things got a little bit better. They did some other things with pain medication, nowhere near aggressive enough to, try to help manage my pain. But, there was some relief there. So my hospital stay, for the most part, was a bit of a nightmare. I was kind of anxious to get home because I knew I had my own meds and I could regulate my own meds when I came home, which I've been doing all right and keeping myself comfortable. So trying to think of the best way to keep this structured here. So that pretty much covers. I went in to general anesthesia, went into the OR, woke up in recovery. Had basically a 4-day hospital stay where they came in, constantly checked vitals, gave me pain medication. Hopefully the hospital that you're at is better than the one that I was at with care. Care for me was you got it when it came to you and you got the bare minimum and you liked it, and that was that pretty much. So I got fitted for a brace that I'm wearing. I'll stand up real fast and show you guys. This is the brace. It goes all the way around. Velcro's on. There's this thing that pulls it tight even further. Snaps pretty, hugs you pretty snug. Keeps your back nice and straight. So you don't want to, do the bending things that we talked about obviously before. You don't want to have to deal with that too much. In the hospital, I talked to some home care nurses that set up, like a pre-appointment for when I got home. Discharge was completely disorganized. They sent me home with no pain medications whatsoever. They told me, whatever I had at home to use it. So it's funny. Well, it's actually not funny, but if I had to choose between the two, where I got the better care, I definitely would have chose it the way that I got it, which was with my surgery itself, because I had a whole team of surgeons, neurosurgeons in there. I had mine, I had his superiors, and I had others in there, so there was, a lot going on there for me with my surgery, and I have no pain in my back that I had prior to the surgery. I only have residual surgical pain, so I'm extremely happy there. As the days go by, I'm only getting better, getting stronger, able to do more things. There's still definitely pain associated there, but getting up and down off the couch, off the bed, things like this, I told you guys I have a hospital bed, so that makes it easier for getting up out of bed considerably. I did try to lay down in my own personal bed once or twice, and getting up out of it was a little trickier. So a hospital bed definitely huge help. I'll continue to use it for a while until I feel I have no need for it whatsoever. I'm trying to think of anything else. I really wanted to get something on here, so this one is not as structured as my other one. If I left something out, if you have any questions, I'm sure you have a million questions. Anybody I talk to that's going through this so far, that I've given the same rundown, have had, you know, plenty of questions. So shoot me an email, post a comment, do whatever you got to do, and I will get back to you. I will answer your question as best possible, and fill in any of the blanks that you might have. All right, my next post will be about, you know, when I got home and how things, you know, have been with that. All right, talk to you guys soon.